I have to admit, these are some of my favorite moments. In my daily work, I spend a great deal of time explaining medical conditions, discussing test results, and helping women navigate very real health concerns. But every now and then, people ask the questions they have secretly wondered about for years. The questions that make them laugh. The questions they hesitate to ask during a short appointment. And, surprisingly often, those are the questions that reveal just how much curiosity and uncertainty still exist around women's health. Over the years, I have learned that no question is too strange, too embarrassing, or too silly to answer honestly. In fact, many of the topics people laugh about are exactly the ones we should talk about more openly. I receive thousands upon thousands of questions whenever I invite people to submit them. I deliberately avoid reading through them beforehand because spontaneous reactions are often the most genuine. So today, I am simply going to pick a number of these questions and answer them truthfully based on many years of clinical experience. Let's begin. The first question is actually not funny at all. Before a gynecologist appointment, should you take a bath, take a shower, or do neither? For me personally, it really does not matter very much. Basic hygiene is always appreciated. I think that simply belongs to everyday courtesy. But whether you prefer taking a bath or having a shower beforehand is entirely your decision. Do whatever makes you feel comfortable. Many women use the restroom at the clinic before their appointment and freshen up a little. They often carry small toiletries in their handbags just for peace of mind. But honestly, unless someone arrives after several weeks without washing, you really do not need to worry about it. Please do not stress yourself unnecessarily. The next question made me smile. Socks on or off during the examination? My patients will probably laugh when they hear this because I am someone who genuinely notices socks. I find funny socks entertaining. Socks with unusual patterns, mismatched socks, tennis socks with giant holes in them. Somehow, I always end up commenting on them. It's not that I have a fascination with socks. I simply notice them. Our practice happens to be located in an older building. We do not have heated floors. During autumn and winter, it can be quite chilly. For that reason, cozy knitted socks are extremely popular. Normal socks are perfectly fine too. Funny socks, plain socks, whatever you prefer. From a practical standpoint, wearing socks simply makes sense because your feet stay warm. We are not judging your feet. Yes, your feet are physically close to us during an examination, but we are not inspecting them or smelling them. And despite what people imagine, I have never encountered a situation where someone's feet were so overpowering that they could be noticed from a distance during an appointment. Even after a stressful day at work, when someone removes their shoes, it has never been an issue. If you truly want to keep your shoes on, that can even be possible in some situations. The foot supports on our examination chairs can be cleaned and disinfected. So honestly, wear socks. Don't wear socks. Keep your shoes on if appropriate. Choose whatever helps you feel most comfortable. The next question was interesting. Have I ever had to examine members of my own family? The wording matters here. Did I have to? No. No one is forced into an examination. But have I examined family members? Yes. And I have absolutely no problem with it. If a family member comes to me, I assume it is because they trust me and feel comfortable doing so. It happens voluntarily. I certainly do not imagine dramatic scenarios where someone insists against their will. So the short answer is yes. I have examined family members. And since we are discussing examinations, I want to remind people of something important. You always have the right to say no. You are never obligated to proceed with an examination if you do not feel ready. If anxiety becomes overwhelming, if you need a break, if you change your mind, you can speak up. In my experience, the instinct to escape that examination chair is surprisingly common. Now, here's a question people ask quite often. Is there a maximum penis size for sexual intercourse? And does someone need to train for it? I am not entirely sure how people imagine this training would work. Would the woman somehow train her vagina to become longer? Or would the man train his penis to become shorter? The reality is much simpler. Penis size is not the only factor that matters. Many people place enormous importance on size, often because society teaches them to do so. But compatibility involves both partners. Vaginal length naturally varies from person to person. A woman may simply have a shorter vagina. A man may have an average-sized penis. Yet contact with the cervix can still occur and may feel uncomfortable for both partners. Occasionally, this can even result in a small amount of bleeding. That sounds alarming, but in many cases it is not dangerous. Sometimes, sensitive cervical tissue becomes irritated from contact. This tissue can bleed easily. The bleeding is often light and painless. Clinical experience shows that these variations are incredibly common. On the other hand, some women naturally have a longer vagina. If, with clean hands, someone has attempted to feel their cervix and cannot easily reach it, that may simply reflect their individual anatomy. In that situation, an average-sized penis may not cause discomfort at all. As with so many aspects of medicine, normal comes in many forms. People are different. Bodies are different. There is no universal standard that determines compatibility. And it is also important to remember that fulfilling sexual experiences do not depend on complete penetration. In fact, satisfying intimacy does not require a penis at all. That statement may disappoint some people, but it reflects reality. Human connection, pleasure, affection, communication, and understanding involve far more than anatomy alone. Another question appears repeatedly. Are there beautiful female genitals? By that, people usually mean the vulva and the vagina. I always find it fascinating that nobody asks whether someone has a beautiful uterus. The uterus is also a reproductive organ, but because it cannot be seen, nobody judges its appearance. Instead, people focus intensely on external features. So let me answer this clearly. There is no universal beauty standard for genitalia. Not for women, not for men. A penis may curve slightly to one side. A scrotum may hang unevenly. Inner labia may extend beyond the outer labia. All of this falls within the range of natural human variation. We can search endlessly for imperfections. Perhaps someone's nose feels too large for their face. One tooth may be crooked. But does that diminish their value? Of course not. I believe we should stop applying rigid beauty standards to intimate body parts. If anatomy causes mechanical problems, that is different. For example, if enlarged inner labia repeatedly rub, become irritated, bleed, or interfere with daily activities, surgery may sometimes be appropriate. But cosmetic procedures performed solely to achieve an imagined ideal deserve careful consideration because there is significant potential for complications and unintended consequences. There are no ugly vulvas. There are no objectively beautiful vulvas. And when people ask whether they have a beautiful vagina, I often smile because the vagina itself is the internal muscular canal that cannot even be seen under normal circumstances. Without medical instruments, nobody is looking at it. Asking whether you have a beautiful vagina is almost like asking whether you have a beautiful intestine. It simply reflects how disconnected many people have become from understanding their own anatomy. What was the worst body fluid that has ever splashed into your face during an examination? I think I have probably encountered almost every body fluid imaginable over the course of my career, except semen. Interestingly, during gynecological examinations, that is one thing I have never actually had sprayed into my face. I have had pus. I have had vaginal discharge. I have had amniotic fluid. I have had blood. I have had breast milk. Breast milk surprises many people. During breast examinations in women who are breastfeeding, sometimes milk is released simply because of the pressure applied during the examination. You are concentrating on doing your job, and suddenly you discover that nature had other plans. When people ask which one is the most unpleasant, my answer comes quickly: pus. I know many people, statistically women especially, seem to enjoy squeezing pimples on their partners' backs. They describe it as oddly satisfying. You could never recruit me for that activity. I genuinely dislike pus. I remember one operation from my years as a junior doctor. A patient had a very large abdominal abscess that needed to be opened surgically. My senior physician was expressing the contents, while I was assisting and holding instruments. I had an excellent view of everything. Too excellent. In fact, a fountain of pus came directly toward me. That remains one of the less glamorous moments of my medical career. Medicine is deeply meaningful work, but it certainly has moments that remind you it is not a television drama. Another question that appears regularly: have I ever been called a cave explorer? Of course. I think every gynecologist on earth has heard every gynecology joke imaginable. If someone has worked in this specialty for years and has never heard that particular joke, I honestly do not know how they managed it. Now, here's a practical question. Has an examination ever been made difficult because of intimate piercings? Yes, it absolutely has. There are many different types of genital piercings, and most of the time they do not create major problems. However, I distinctly remember examinations where certain pieces of jewelry interfered with the instruments we use. One piercing in particular ran vertically through the clitoral area. As I attempted to insert the examination instrument, I repeatedly encountered resistance because the jewelry occupied exactly the space I needed. I found myself maneuvering around it very carefully. The examination was still possible. It simply required more patience and, of course, extra caution. Nobody wants to damage a piercing or accidentally cause pain. The next question comes up constantly. Have patients ever made sexual advances toward me? I cannot even count how many times I have been asked this. It reveals how strongly people tend to sexualize this profession. I think people imagine dramatic movie scenes, but I often wonder how they picture this actually happening. A woman is sitting in a gynecological examination chair during a medical examination, and suddenly she begins flirting? How exactly would that unfold? From my perspective, the environment itself is not remotely erotic. It is a clinical setting. There are bright lights, medical instruments, documentation, questions about symptoms. There is absolutely nothing romantic about it. People also ask whether I ever have sexual thoughts during examinations. Let me answer that directly. No, not at all. And I believe I speak not only for myself but for gynecologists everywhere. Being naked does not automatically create sexual attraction. Human sexuality is far more complex than that. Research into attraction has repeatedly shown that context matters enormously. Nudity alone is not what creates desire. In fact, many people find suggestion more appealing than complete exposure. A person working in the garden wearing jeans may appear more attractive than someone standing entirely naked chopping wood. A crowded dance floor in summer where people wear lighter clothing often feels more intriguing than a room where everyone is completely undressed. The imagination plays a role. Emotional connection plays a role. Chemistry plays a role, so no. I do not have sexual thoughts during gynecological examinations, and no. I have never received sexual offers from patients during examinations. Outside of examinations, have people occasionally flirted? Of course. Doctors are human beings interacting with other human beings. But that is entirely different from what people often imagine. The next question genuinely saddens me because it highlights how much education is still needed. Can you become pregnant through anal intercourse? The answer is no. You cannot become pregnant through anal intercourse. Your digestive system and your reproductive system are separate structures. The rectum and intestines are not connected to the uterus in a way that would allow pregnancy to occur. Even if someone imagines a theoretical scenario involving sperm and eggs somehow reaching the digestive tract, the intestinal lining is completely different from the uterine lining. It is not designed to receive and support a fertilized egg. Clinical practice constantly reminds me that people are often embarrassed to ask these questions. But embarrassment should never prevent education. There is no shame in not knowing, only missed opportunities to learn. Another very common question is this: can a gynecologist tell whether you had sex recently? Or if you had sex the night before, will your gynecologist know? The answer depends on timing. If intercourse occurred only a few hours before the examination, certain signs may still be present. The vulva may appear slightly swollen. The vaginal tissues may still show increased blood flow. Ejaculate may still be present. In those circumstances, it is sometimes possible to suspect recent sexual activity. However, if intercourse occurred the previous evening and sufficient time has passed, we generally cannot tell. There is no bright red warning sign announcing what happened yesterday. People often worry unnecessarily about this. That said, there is a practical reason why avoiding intercourse immediately with certain appointments can be helpful. It is not because we are judging anyone. It is because sexual activity can temporarily influence examination findings. For example, the healthy vaginal environment usually maintains an acidic pH. Semen is more alkaline. If we perform tests shortly afterward, the altered pH could potentially affect our interpretation. A perfectly healthy person might suddenly appear to have an abnormal result that requires unnecessary clarification. So while it is not a disaster, a little timing consideration can occasionally make medical assessments easier and more accurate. One of my favorite questions involved labor and delivery. What are the most memorable things women have shouted during childbirth? I think I have heard every possible curse word. Labor is physically demanding, emotionally intense, and deeply human. Women say things during labor that they would never normally say, and that is perfectly understandable. One of the funniest moments involved a woman whose labor had been long and exhausting. She had simply reached her limit. With complete sincerity, she looked at us and shouted, "Just cut Gollum out of me already." I remember trying very hard to remain professional. Afterward, she apologized repeatedly. I reassured her that there was absolutely nothing to apologize for. Childbirth has a way of revealing honesty in its purest form, and honestly, I found her comment incredibly endearing. Another question I hear almost every day is this: How can you do that job? I could never do it. That has become the story of my life. People say it constantly, but I usually answer with a question of my own. What do you do for a living? Someone might say they are a baker. Someone else might work in a factory. Someone might be an accountant. And my response is often the same. I could never do that. The truth is that every profession becomes normal to the people who practice it every day. We all find our own path. What seems impossible to one person feels completely natural to another. That diversity is a good thing. The world would not function very well if everyone wanted the same job. Now, for a question that connects nicely with something we discussed earlier. Have I ever been kicked in the face by a patient? Yes, I have. Many years ago, when I was younger and less experienced, I sometimes tried to lighten the mood during examinations with small jokes. If a procedure felt uncomfortable, I might say something like, "If it hurts too much, just kick me." The patient's feet were often positioned very close to where I was working. At the time, I thought it was a harmless joke. Then one day, whether by accident or reflex, a patient actually kicked me. I honestly do not think she intended to hurt me. She simply reacted to an unexpected sensation. But after that experience, I retired that particular joke forever. So yes, I have had feet in my face. Not only during examinations, during deliveries as well. When women are pushing during labor, legs move in all sorts of directions. Sometimes a foot ends up against your hip, sometimes against your shoulder, occasionally almost everywhere else. After enough years in medicine, very little surprises you. Another question that appears in every question session is about passing gas. Have I ever been farted on? Yes, absolutely. Every gynecologist listening to this will immediately recognize the situation. It happens. Human bodies do human things. This is especially common after childbirth. The muscles of the pelvic floor and the anal sphincter have often been under tremendous strain. Sometimes epidural anesthesia can contribute to reduced awareness of bodily sensations for a short period as well. Even during routine examinations, it can occasionally happen. Most women are actually very aware when gas is building up. They may mention it beforehand. They may ask for a quick moment. They may excuse themselves briefly. In many cases, it is avoided altogether. But over the course of an entire career, it will happen sooner or later. And honestly, it is not a problem. It is a bodily function. Medicine teaches you very quickly that embarrassment often causes more suffering than the event itself. The next question is one I hear surprisingly often, even from friends. Are gynecologists better at sex? That is a difficult question to answer objectively. After all, I have never had sex with another gynecologist, and if I did, their expertise would primarily involve female anatomy, not mine. So I cannot provide any scientific comparison. What I can say is this: gynecologists generally understand anatomy very well. We know where structures are located. We understand how the body functions. We understand sensitivity, comfort, lubrication, hormonal influences, and many of the factors that affect sexual well-being. Does that automatically make someone a better partner? Not necessarily. Good intimacy depends on communication, empathy, attentiveness, trust, and emotional connection. Those skills can be learned by anyone. You do not need a medical degree for that. Now for another question. Are the wives, girlfriends, or partners of your friends also your patients? Yes, some of them are. And I always consider that a tremendous expression of trust. Gynecology involves discussing intimate topics and performing examinations that require a high level of comfort and confidence. When someone who knows me personally chooses me as their physician, I appreciate that trust very much. The next question is fascinating. Have I ever had to remove unusual objects? Yes, many times. Popular culture loves to make jokes about these situations. People immediately imagine bizarre stories involving random household items. And while unusual objects do occasionally appear, the reality is often much more serious than people realize. Behind many of these cases are difficult circumstances, mental health struggles, past trauma, histories of abuse, situations that are not funny at all. That is why physicians approach these situations with sensitivity rather than amusement. Of course, there are also genuine accidents. Objects become stuck. Experiments do not go as planned. People panic. One object I remember particularly well was a chestnut. It may sound simple, but it was surprisingly difficult to remove. The smooth surface provided almost no grip. Sometimes the most innocent-looking object can become the greatest challenge. Medicine has a wonderful way of keeping you humble. Another question asked whether I have ever been confronted by a patient's jealous husband or partner. Not really. At least not in the way people imagine. The partners who accompany patients are there because they choose to be. Most are supportive and respectful. During childbirth, however, emotions can run extremely high. Fear, anxiety, helplessness, and concern sometimes cause people to behave differently than they normally would. Occasionally, a partner becomes overly protective. Sometimes they become tense or defensive. But when you understand that these reactions are usually driven by worry rather than hostility, it becomes much easier to guide the situation calmly. One question many people find surprising is whether men ever visit a gynecologist. The answer is yes. There are several situations where this happens. Men can develop breast cancer. Men can discover lumps in breast tissue that require evaluation. Couples experiencing fertility difficulties often attend appointments together because fertility involves both partners. I recently examined a male patient who had discovered a lump and required breast imaging. Gynecologists perform breast ultrasound examinations regularly and often have extensive experience with them. There are also transgender patients receiving care during various stages of transition. Medicine is ultimately about helping people, and people come in many different forms. Now, for one of the strangest things ever sent to our practice. It was not exactly a gift. It was a stool sample. Many screening programs use stool testing to look for hidden blood. Occasionally, patients who cannot come to the clinic send samples by mail. One day, a package arrived. Inside was a box of dark chocolate. I still remember noticing that the packagings looked slightly unusual. Someone opened it. Instead of chocolate, there was a stool sample container. To this day, I do not know whether the patient was making a joke or whether that was simply the only box available at home. But I can tell you that the entire office laughed, not at the patient, just at the unexpected surprise. As for actual gifts, there is one thing healthcare workers receive more than almost anything else: boxes of chocolate, especially a certain brand that seems to exist in every clinic, every hospital, and every medical office on Earth. Please understand, we appreciate the kindness, we truly do. But after enough years, entire drawers become filled with unopened chocolate boxes. The generosity is wonderful. The storage space becomes less wonderful. As always, there are many questions I did not have time to answer today. Some were funny, some were thoughtful, some revealed how many misconceptions still exist about the human body. And honestly, those are often my favorite questions because they create opportunities to learn. In my years of practice, I have seen how much anxiety disappears when people receive clear, honest explanations. Many details about everyday health simply do not fit into short medical appointments, which is why I enjoy sharing these conversations with a wider audience. Thank you for spending this time with me. I hope some of these answers made you smile and perhaps taught you something useful along the way. If this video has been useful to you, please give it a like, subscribe to the channel, and turn on the notification bell. Help me reach 50,000 subscribers so that more people can receive this information.